Hi, I'm Dr. 𝒂𝒏𝒆💄💏, and today I'm going to talk to you about how chiropractic can help out with vertigo. If you've ever had vertigo or you're experiencing it right now and trying to find solutions, I feel for you. It is one of the most scary things that you can experience as a person. And so in doing that, there are a couple of causes of vertigo. And so the first thing to know is, well, what causes balance and what causes you to not feel that? Well, there are a couple areas in your body that are designed to help know where you are in space. The first one is your eyes. And so your eyes do a great deal of telling you where you are in space. There's something called the writing reflex that your eyes use. But you can even test it very simple, is if you stand on one leg and you hold yourself up with your eyes open, it is significantly different than if you try to do it with your eyes closed. And that tells you how much the eyes are involved. The other thing that you want to realize is that your ears give your brain a lot of information as well. So there's canals in your ear, and there's crystals that can also get dislodged, and that can also cause vertigo as well. Additionally, realize that the nerves in your spine give your brain a lot of information about where you are in space. So the areas that have the most amount of information, nerves to your brain telling you where you are in space, are your feet, your pelvis and sacrum, but a huge area is the upper cervical spine. And so a lot of times people can have upper cervical spine or upper neck issues where the body can go out of alignment, and that can give poor information to the brain and then producing the sensation of vertigo. So if you came to a chiropractic office that is experienced with vertigo, and my advice on that is actually call the office ahead of time in your area and ask if they do patients and take care of patients with vertigo before you go out there and go to that office. The other thing is make sure that you have someone driving you as well, so that you don't put yourself at risk for an auto accident and now you're a patient for that condition as well. But you want to make sure that when you're going there, and they can do things like something called an 𝒂𝒏𝒄𝒏 type maneuver. And that's a maneuver where we can actually reposition the body through a series of maneuvers to help move those crystals in a proper position to take stress and tension off of the nerves that can cause and simulate and tell the brain about that vertigo. The other thing is, like I said, is in the neck and the lower back. The neck has a lot of information there, so by properly getting x-rays in that area and getting that area repositioned, that can take a lot of the stress and tension that can cause a vertigo symptom. So we see great success in our practice over the past 20 years in helping patients with those conditions as well by just correcting the neck. The last thing that you want to think about is, in working with your healthcare providers like your primary care and your ENT, or going to the emergency room, taking a medication like antivert can help out the symptoms associated with vertigo or dizziness, but it's not correcting the cause of the dizziness. So you want to make sure that you're correcting the cause of it. So if you're having an episode currently, now is a perfect time to reach out to those providers, including a chiropractor. Or even if you had episodes in the past and it recurs and you want to make sure you prevent future issues, make sure that you seek chiropractic care in your area as well. So I'm Dr. 𝒂𝒏𝒆💄💏 with Synergy Oviedo Chiropractic. Make sure if you like these videos to like them, to subscribe, to ring the bell, to share, whatever it takes to get the word out. Thank you.